In this video, we will briefly discuss the steps that need to be taken if an autism spectrum disorder is suspected. First, make an appointment for diagnostics with a professionally qualified contact point who is familiar with the autistic spectrum. This can be ordinary clinics, outpatient clinics, or practices for child and adolescent psychiatry. Other alternatives are specialized practices for psychotherapy or social pediatric centers. During the diagnostic process, various examinations, screening instruments, and clinical testing procedures are used. The performance of a differential diagnosis is of particular importance in order to be able to differentiate ASD from other developmental disorders. Let us now look at how the process of diagnosing an autism spectrum disorder actually looks like. First of all, medical diagnostics will be performed during the process. This includes vision and hearing tests, physical examinations, and, if necessary, a human genetic examination. An anamnesis from birth to the current time will also be collected. This includes psychiatric examinations, autism-specific test procedures, psychopathological findings, and, if necessary, any further disorder-specific diagnostics. In general, an intelligence diagnostics and/or a developmental diagnostics will also be performed, and if necessary, language developmental testing may be performed as well. The autism-specific diagnostics generally consists of two main elements, namely a diagnostic interview and a procedure to detect behavioral anomalies. The Autism Diagnosis Interview Revised, ADIR for short, is a very comprehensive diagnostic interview for autism. The interview contains 93 items in total, which deal with early childhood development, language acquisition and possible loss of language skills, verbal and non-verbal communication skills, play and social interaction behavior, stereotyped interests and activities, as well as comorbid symptoms. The second element of the autism-specific diagnostics is a procedure for detecting behavioral anomalies. Autism Diagnostic Observation Schedule, or ADOS-2 for short, is a structured procedure for detecting anomalies within the communication, social interaction, and children's play behavior. The observation schedule contains 5 different modules. The toddler module is for toddlers aged 12 to 30 months who do not use sentences consistently. Module 1 is for children from the age of 31 months who do not use sentences consistently. Module 2 is for children of any age who consistently use sentences but do not yet speak fluently. Module 3 is for children and young adolescents who speak fluently. And Module 4 is for older teenagers and adults who speak fluently. After completion of all testing procedures, the autism diagnosis is either made or excluded. If needed, apply for an autism-specific therapy as soon as possible. Depending on the federal state, either the local social welfare office or the supra-local social welfare agency is responsible. The Youth Welfare Office can also be responsible, especially for school-age children with good cognitive abilities. The application can be submitted informally to the responsible institution or office. When choosing a therapy facility, it is advisable to pay attention to the qualifications of the employees and the therapeutic approaches. According to the current state of knowledge, learning psychology and behavior therapy offers are the most successful. Note that well-founded autism therapy does not know endless care or promises of cure, but defines individual objectives that are set down before intervention begins. Depending on the federal state, there are different professional counseling institutions for parents and schools. These should be involved as soon as possible. Children with autism, like all children with disabilities, are also entitled to disadvantage compensation. Finally, the decision to attend a special school or a regular school is also an important consideration.